I want to welcome you to this official opening press conference on TB prevention. So, of course, we are delighted to see the emergence of some good science and prevention being presented in this conference this week. On that note, we should start.
Despite TB being a preventable and treatable disease, it still remains a very important cause of morbidity as well as mortality in people living with HIV, whereby once they're tested positive, we would like them to start on ART, and we also try to find out if IPT starts were actually aligned with that particular strategy, and found out that about 91% of the people that were initiated on IPT were started on the same day that they were started on ART. These results or these findings actually demonstrate an effective early phase scale-up of IPT among people living with HIV in Malawi, which may serve as a model for other countries that are planning to implement similar national programs.
Our Swazi research team interviewed patients in person at their healthcare facilities using a standardized interview guide, asking them what helped them complete treatment. And what we learned was that all three interventions seemed to be critical. So nearly all, 99%, reported that linking IPT with their antiretroviral refills was important. They said things like, "We were used to taking ART. We just added IPT to our normal routine." Also, linking refill pickups served to save time and transportation costs for patients.
So the TT study is an implementation study which was conducted and coordinated by the Union in 4 countries in Francophone Africa: Benin, Burkina Faso, Cameroon, and Central African Republic. Younger children are very high risk of getting the disease and severe disease. So it is really now recognized that screening children in contact with pulmonary TB cases is among the most effective strategies to detect and to prevent TB. Household contact management would prevent more than 160,000 cases of tuberculosis and more than 100,000 deaths in children. So while contact investigation and preventive therapy is strongly recommended for children, especially children under 5, we estimate, and WHO estimates, that over 75% of children who are eligible for this intervention do not access preventive therapy. Standard tools have been developed, training of house staff have been conducted, and the rollout and the scale-up of these activities in this country is hopefully taking place.